Perform a strict identity check by asking the patient to state their full name, age, and the exact examination requested. He then explains the full nature of the examination, ensure she has removed any artifacts causing materials such as rings or watches, and ask if she has any questions. Finally, he obtains clear verbal consent before proceeding. We will now demonstrate the posterior anterior hand. The posterior anterior hand should be performed with the patient seated at the end of the radiographic table, with the image receptor placed tabletop with a 40-inch SID and no tube angulation. With the patient seated comfortably, the elbow is bent at a 90-degree angle before placing the hand right in the middle of the IR. The radiographer centers at the third metacarpophalangeal joint and spread the patient's digits out uniformly. Collimation is done to include all the anatomy, the metacarpophalangeal joints, metacarpals, carpals, and all phalanges. The radiographer then places a marker within the light field and the exposure is made. This is a posterior anterior hand X-ray image. For fan lateral positioning, fan lateral should be performed with the patient seated at the end of the radiographic table, with the image receptor placed tabletop with a 40-inch SID and no tube angulation. Now for the lateral, the radiographer places the hand on its side for a fan lateral, which keeps the metacarpals at 90 degrees. Every finger is stair-stepped, so each digit is visible, keeping the thumb straight, and then the collimation is made an inch around all digits and 1 inch above the carpal bones before the exposure is made. This is a fanned lateral hand X-ray image. We will now demonstrate oblique positioning. The oblique positioning should be performed with the patient seated at the end of the radiographic table, with the image receptor placed tabletop with a 40-inch SID and no tube angulation. The radiographer is going to turn the patient's wrist up about 45 degrees laterally from the posterior anterior positioning, keeping each finger separated, still centered at the third metacarpophalangeal joint. All digits are within the light field, the marker is present, and then the exposure is made. This is an oblique hand X-ray image.